All right. So, hi everybody. Today we are having an interview with Dr. Daniel Cobb. He's a graduate of Loma Linda University from 1977, and then after that he did a master's in public health from University of Loma Linda. And for 7 years after that, he practiced dentistry in Africa. So he has seen other part of the world and quite aware of internationals as well. And after that, he has been practicing as a general dentist in Dayton, Ohio since 1986. And the reason I have Dr. Cobb up here is because he was also my evaluator. He wrote me a letter of reference for University of Colorado. And I have been able to learn a lot from him from a perspective of holistic dentistry, patient management, and what ethical dentistry is in United States. So thank you, Dr. Cobb, for being with us today.
Thank you.
And correct me if I said something wrong during your introduction or I mixed up the numbers.
You were very good.
Okay.
I think that encapsulated it.
All right, thank you. So, Dr. Cobb, you graduated from Loma Linda University, and people from your family has also went to Loma Linda, right?
That's correct. My daughter graduated from dental hygiene school at Loma Linda back about 12 years ago.
Okay. And one of the reason I wanted to talk to you about University of Loma Linda, because it's quite different from the rest of the schools in United States when it comes to their values and their discipline. And as a new person to United States, I always has questions like, why is Loma Linda different? Even their application ask you questions like about your spiritual life, about whether you will be follow discipline in terms of your dietary, and will you be able to attend classes like Christian classes, and what's the whole structure upon which Loma Linda is built? What's the whole idea, and what makes it different from the rest of the dental schools?
Well, Loma Linda is owned and operated by the Seventh-day Adventist Church, which is a Christian Protestant church that's been around for 150 years. And the Adventists believe that we want a whole person. And so the university's motto is actually to make man whole. So that's why Adventists look at education a lot. And in third world countries, you'll find a lot of Adventist primary, secondary, and colleges. And then medical institutions embody, healing people and getting people healthy, so that because our body is, for lack of a better term, not our own, it's really a temple of God. And so that's why Adventists look at temperance and look at how can we make our body as healthy as possible to be a structure for God. So that's sort of where this comes from, to make man whole, and it embodies the physical, the mental, and the spiritual. And so that's probably why you were asked questions about, would you have a problem going to some Christian classes? In dental school, when I went to school, we had religion classes all through dental school, I think every quarter, every other quarter, something like that. Now, you aren't made to believe what might be taught. You can have your own opinion. Nobody's going to put you down for that. But because it is a religious school, for lack of a better term, it's owned and operated by the church, that there is more of an emphasis on the spiritual than what you would get in any other school in the United States, probably.
So one question, doctor, if I don't believe in Seventh-day Adventist doctrine, or if I'm not a Christian, being in those classes and learning the spiritual side of Loma Linda, would it be beneficial for me when I go out, or is it something which is brainwashing me? I'm coming off from an international perspective.
Sure, you won't be brainwashed, and what it will do is it give you a well-rounded education for you to see, okay, what is Christianity about? If you come from a non-Christian background, especially, you get to kick the tires and look at it, but nobody is going to force you to believe anything. You can, if you're a Hindu, you can believe Hinduism. If you're a Muslim, you can keep with Islam. That's not a problem. But because it is a church-oriented school, there is an emphasis on religion, but it's not overwhelming. You don't come out with a religion degree. You don't have to go to church every week. Those kinds of things. When you have the chapels, because when I was in school, once a week we would have a chapel where the whole school would sort of get together, and it would be a time where we would learn announcements for the school, but then there would be a spiritual lesson in there also. So it they aren't made to proselytize you. I wouldn't think that anybody would have that feeling that, oh, they're trying to make me become an Adventist. I don't think that's what would be there.
Okay, because just sharing my own context, I did my undergrad in Pakistan, and I used to study Islamic studies during my undergrad, and no part of me would say that I got damaged or something negative happened to me. Actually, it makes me a bigger human being, since I can relate to other people as well. I know what their culture stands for, what their education is. So I personally think if you're given extra education during your undergrad as a dentist, it makes you profoundly more intelligent than the rest of the folks out there. And as an American, like, for example, I'm an immigrant and I get to study a little bit about Christianity, a little bit about Seventh-day Adventists during my undergrad. Do you think when I come out and practice in United States, it will be better for me to have that knowledge in my arsenal?
I think because the United States of America was based on Judeo Christian ethics and morals, that's what you would be learning. And so I think it would be helpful to know what many of your patients would be, and what their relationship with their God is, and it would give you an idea so that it would make it easier for you to connect with these patients in the future and everything like this. I wanted to go back and say that you don't have to believe what is taught in these religion courses or chapels, and it's not going to affect your grade in dentistry. So you don't have to worry about being blackballed or anything like this if that is not what you believe. And you know you will still learn as a dentist and come out as a highly qualified dentist. And then the only thing that the school would probably ask is that you be respectful of the ethics that is being taught and that the church believes in, things like this. You don't have to follow them per se, but be respectful of them. For example, in the Adventist Church, we prefer people not smoking and drinking, and so it wouldn't be tolerated to have you smoking at the dental school. Now, what you do in your own house is probably up to you, but it wouldn't be tolerated for you to be smoking in dental school. The same thing with alcohol. It would be definitely frowned upon for you to bring a six-pack into the dental lab while you're waxing up your crowns, and chugging back a few beers, kind of thing. That would be inappropriate.
So, if I could, let me relate this to something. So, I'm coming from the South Asian culture, like subcontinent. The whole I don't, and I went to school up here for masters. What you're telling me is a bit of a discipline, right? A bit of a discipline as compared to other universities in United States. Do you think so? If I am told not to drink and smoke during within the campus, and this is an ethical thing, do you think overall in my life later on, following some kind of discipline in my life will make me a better professional?
I think it will, because when you get out, you're going to be the judges to the quality of your dentistry. And if your ethics are, if I can get it past the lips, it fits, that's one level. Or if you say, hey, I want to make sure that my margins are good, that my occlusion is good, and if it doesn't work, I'm going to continue getting it so that it will work for that patient, because I want to have the best possible outcome for that patient. And so, slipshod work doesn't work.
Okay.
And we see too much of that. And I think at dental school, hopefully that would be drummed out of you, that you would understand, okay, what is okay and what is good and what is not okay, and be able to form those judgments so that when you get out and no dental instructors looking over your shoulder, you will be able to keep that ethical competency up.
Okay. Since we are talking about dental practice, and I want this is a question about people who are graduating or looking forward to having your practice and stuff like that. I personally I've been shadowing Dr. Cobb, and he runs a holistic practice, which is quite uncommon. Like, at least for me, I haven't seen much people utilizing the holistic dentistry. And the one of the reason I'm actually interviewing him, because he's not just a dentist. Dr. Cobb has some deeper wisdom to life. As from my perspective, when I saw him practice and dealing with other human beings, with his staff, there is some kind of deeper wisdom to his practices. And the reason I'm saying is not because of how much production he does, because the reviews and the feedback his customer gives when he's not even around in Dayton, they are pretty much, not pretty much, but really satisfied, and they have this really optimistic and trust. They have this trust on Dr. Cobb that whatever he's telling us or giving us a treatment is something valuable, and they trust him. So, coming to holistic dentistry, why have you chosen an aspect of pursuing holistic dentistry in your daily life or in your practice?
Um, I really want to come to have the best health possible, that I can live as long as possible with a quality of life as long as possible. And there are various things that we can do to shorten our lifespan or to lengthen our lifespan. And during that lifespan, how healthy do we feel? How good do we feel versus how bad do we feel? Um, so those things that we're looking at is, we know that if you have a infected mouth periodontally or dental caries, that you are not going to live as long. And for example, if you have less than 24 of your natural teeth in your mouth, your lifespan is significantly reduced as compared to if you have 28 or 30 or 32, something like that. And the other thing is, how can we keep our teeth in our mouth for our life? Because that's how I think we were designed to function, is to have our 32 teeth in our mouth for our whole life. So there are various things that can create the length of having those teeth in our mouth, and one of those is having gum health, having good periodontal health, because that affects systemic illness in other parts of the body to a high degree. For example, we know that if you have periodontal disease, that your risk of a heart attack or stroke or diabetes is significantly higher. We know that if you have root canal teeth, that there is infection at the apex, chronic apical periodontitis, for example. That bacteria shows up in the coronary artery and gets the inflammation going on in the coronary artery, that blocks the coronary artery, that can cause a heart attack. And so we know those things. And so why are we keeping infection in the mouth versus getting rid of infection in the mouth? Another aspect is fluoride. We've been told by the American Dental Association that fluoride is the greatest public health advance in 50 years. and you start looking at fluoride and what does it do to the body, and you have to say, okay, where did you get your research from, and where did you get your information from, and let me see it, because we know now that fluoride is a neurotoxin. Fluoride reduces IQ in newborn, in utero babies, and so when they're born, they come out with an IQ of half of a standard deviation or more for the rest of their life. Why do we want to put an IQ of a half of a standard deviation, which is about 7 IQ points, lower for the mother to take a neurotoxin called fluoride? But in the dental arena, fluoride is a huge thing, and fluoride is out there, and the dentist, by and large, almost all dentists say, yes, you want to have fluoride, and the more the better kind
Yep,
of thing.
yep.
The second thing is mercury. Mercury is a known neurotoxin, and it's also, it kills cells of any kind. It will just gum up the Krebs cycle, and that's not a good thing either. And so if you've ever heard of something called Mad Hatter's disease, that is acute mercury toxicity.
Mad
We don't
Hatter.
hear Mad Hatters.
Okay.
It used to be 150 years ago, you would take skins of animals and you would create felt so that you could make felt hats. And so what you would do is you would put the skins in a mercury bath and you would boil it, and you'd stand over the mercury bath and you would stir the skins to get the felt, and so you'd breathe in all of these mercury vapors, and then you went crazy. And so there was a disease called Mad Hatter's disease where people would just go insane, and it was because of acute mercury toxicity.
So one
We
thing,
don't we don't see too much of that today, but we see chronic mercury toxicity, and when you start adding the pesticides along with the heavy metals such as aluminum and mercury and chromium and those kinds of things, that adds up to public health illnesses in people, and you start combining things of these together, and you get issues. And if you heard about the in Flint, Michigan, a couple of years ago, where they had problems with treating the water, and then they found out that there was too much.
in Toledo, Flint area.
Yeah,
Yeah, yeah.
this is the same kind of thing. So, a holistic dentist is looking at that, and a holistic dentist is saying, okay, since I know that mercury is an issue, I'm not going to treat my patients with mercury. I'm not going to do amalgam fillings. Since I know that fluoride is an issue, I'm not going to treat my patients with fluoride. I'm not going to give fluoride rinses, and I'm not going to do fluoride trays for kids, which was prominent when I was going to school, because we're looking at the total health of the individual.
So
That's sort of what holistic is.
So one thing, and most of the audience who's going to be looking at this are going to be students or candidates who are planning to go to dental school. And this is something I ask you, if I remember, if somebody says this to the school that mercury is toxic to chronic toxicity or fluoride is being toxic to newborns, and would you recommend that saying this in a school interview or like something like this?
No, because dentistry is really pretty closed for some things, and the American Dental Association is still recommending fluoride treatments, and they're still recommending mercury fillings. It just came out a few months ago that the FDA, I believe, said that you shouldn't place mercury fillings in small children or in pregnant mothers. And that's a new day, but that just happened a couple of months ago.
Really?
And so when you hear stuff like this, when the research and the evidence has been out there several years, I mean a long time, the research has been there, but that hasn't happened to fit into the genre that traditional dentistry wants to hear. Traditional dentistry wants to use mercury fillings to place into people, and they want to use the fluoride because fluoride is a real moneymaker. You know, you can charge and get a lot of money for doing a fluoride treatment in your office. When you know, it takes you 2 minutes of work to do, you can get a lot of money from that. But if you don't give the fluoride treatments, then you can't charge for it. So, uh, but if you want to help the patient, you don't want to give them the fluoride,
Okay.
neither the.
So one other question is, so this is from a holistic health point of view of the patient, but as a dentist, for example, I'm a fresh graduate and I'm graduating and I want to pursue this holistic dentistry approach and I want to learn. Would you think this would be financially stable, or I would still be able to make a financially suitable environment for myself while pursuing this kind of dentistry in United States?
Well, if you want to be a holistic dentist or go down this avenue, you sort of have to decide: am I going to go whole hog or no hog?
What
Um,
does that mean?
well, what that means is that you can't be half of a holistic dentist.
Okay.
So it's like breakfast. You know, the chicken says, "Yeah, I'm going to give my egg for breakfast," and the pig says, "Well, I've got to give my bacon for breakfast." So which one is giving more? Is the pig giving more to the situation, or is the chicken giving more to the situation? Well, the pig is, because he's sacrificing his life to make the bacon. The chicken just lays an egg and says, "Okay, here's the egg. I'll lay another one tomorrow." So you got to be whole hog in this. You've got to um, embrace it 100% or nothing. It's hard to do it 50-50. You can't do mercury fillings on some people and non-mercury fillings on other people and expect to be thought of as a holistic dentist.
So since you're talking about embracing a lifestyle which is sacrificial, and I'm this is something I want to get out to the fresh graduates, but pursuing this kind of dentistry still allows you to make a good certain lifestyle as compared to other production-based organizations like dental practices, which are high on production all the time. So
Yeah, I think better, because there are very few dentists per capita that are doing this kind of dentistry. And there are more and more and more and more people who want this kind of dentistry. They don't want to go to a dentist that's going to put a mercury filling in a posterior tooth. They want either composite resin or zirconia crown or something like this. And so they are looking for dentists that will practice this way. There are more and more people who are saying, I'm reading a lot about root canal teeth and how they might not be healthy to me. Um, but most dentists would recommend a person to have a root canal if they have an infected tooth, to recommend a root canal versus an extraction or an implant or a bridge or something like this, knowing that that tooth that's root canal will always have infection in it. So those are the kinds of things that you can say one way or the other. So, for example, with me, I give my patients informed consent. If they have an abscess tooth and they need to either have a root canal or an extraction, uh, I will educate them as to what I see going on, what they need, and I leave it up to them to choose. If they choose to go to the endodontist and have a root canal done, I'm okay with that. But they've been acknowledged as to what the issues are, and then they can make their own decision that's best meets them. So I'm not forcing my stuff down them, but I would not do a root canal now.
So the you said this is a wonderful idea that you said, being an ethical dentist, you give them the pros and cons of both sides, and then you let them decide whether they want extraction, implant, or they want root canal and a crown. So you need
Correct.
to provide them all the information and consent before they go for any treatment, right?
Right, right. And I do not treat them any differently if they choose. I personally would not have a root canal, but if they choose to have a root canal, I'm not going to treat them any differently or any less because they've made that decision.
Okay. And one other thing you said, living sacrificially or sacrificing and be having a lifestyle that goes along with you. Not being a dentist, like I'm talking about the cultural aspect throughout the world where wherever they see dentist, the dollar sign comes up. This is really funny. If you tell somebody I'm a dentist, the only thing they will see in you is dollar sign. And especially in US, they imagine doctors like dentists would be driving a Mercedes or God knows like a Lamborghini, and there's no sense of sacrifice. Why are you saying like being a dentist we still opt to, like we choose our decision in a way that's better for us and the people around us? Why do you say that? And from your experience of life?
Um, yeah, you're right. Too many dentists, too many people want to become dentists, and too many dentists see the dollar sign as their god.
Yes.
And that, I think, they look at the patient as somebody that can provide those dollar signs to them, put those dollars in their pocket, instead of looking at how can I help this patient have better health and be healthy and not have pain and function better for their life. These people are looking at it as how can I make a lot of money from them, and that's the wrong outlook that I would recommend. And I wouldn't hire an associate, or I wouldn't want a dentist to become part owner with me in my practice if dollar signs were the most important thing in their mind. Uh, I think that if you treat people properly and you treat people well and you take care of people, the dollar signs will come to you without you having to beg for them. You will have a good living, you will earn well, you know, all of those stuff will come if you treat the people properly and treat the people as you would want to be treated, which, by the way, is another Christian ethical outlook on life. Is you want to treat people as you would want them to treat you.
So one of the questions in relation to this, most of the younger folks, immigrants and local, they believe if I get into a school and get a DDS, it's like I'm gonna get or a dental license. This is my ticket to heaven. Like I'm all good. And you being on the other side of the curtain for so many years, can you tell us, like, for somebody who's going for DDS and think he's going to graduate and everything will be all good and life will be like it's going to be smooth? Can you tell us about the practical aspect of how life is after, even after DDS?
Um, just because you have a DDS behind your name doesn't mean that you're going to earn a lot of money, and especially at the get go, at the beginning. I earned very little money for the first 10 years of practicing back here in the United States, and I earned very little money when I was in Africa. So for the first 20 years of practice, I earned very little money, but I knew what I was getting myself into. And I knew when I came back to the States that I wanted to be my own boss, and I didn't want to work for somebody that was going to direct what I wanted to do. I wanted to work for myself. So I early on went the ownership route, is that I wanted to become an owner. And so, times, it depends upon the times as to how easy and where you're located, as to how easy it is to open a cold dental practice, a brand new dental practice. Um, and I opened cold. I didn't buy a dental practice in the very beginning. Um, and so, you just have to look at the long game of it. Okay, so, at the end of my career, will I have enough to live on? Will I have enough money to retire with, and everything like this? And it's worked out, and it's worked out well. But it's not heaven the day that you graduate from dental school. It's hard work. It's long work. You can't expect to be playing all the time and earn a lot of money. You've got to be in the office. You've got to be working hard. You've got to figure out how to treat patients right, how to treat your team right, and make a go of this.
Since, okay, this idea, I'm going to ask you this question. Since you said treat your team right, and I've been to a couple of different production based and different clinics, and not at many places the team is happy with the management. And at your practice, that's one of the things that even if you're not there, everybody's working in the same way when you're there, and they're happy. And I know this because I've been in the team, like I'm there all the time, and they are happy. Well, like, how do you do that? Because most dentists and practices are just about number, and they don't give a damn about their DAs, about their FDAs. And but why do you look at these things from a different perspective, and what's the reason?
Well, if you want to get the most out of people, you have to treat them right. And again, you have to treat them as though as how you would want to be treated. You want to treat them fairly. At times you have to discipline, at times you have to correct, at times you have to, you know, be a little bit strong in saying, hey, this is not how I want this done. This is how I want this to be done. Those kinds of things. But, if they know that you're there to take care of them, then they will give back and they will want to take care of you. So it's a symbiotic relationship as to, if I treat you well, then you're going to treat me well.
Makes sense. So if somebody's come, and this is a dilemma for a lot of international dentists when they come out of graduation with loans more than $300,000, $200,000. They need visas. They go for jobs which are more production based. And I'm not
Sure.
highlighting any, but they have to because they want visas. And even though, what do you suggest for them, for somebody who wants to pursue holistic dentistry on long run, but for this time he needs visa and he has to work in a different kind of a situation which doesn't resonate with him. So what do you suggest him or her?
Well, if they want holistic dentistry, there are various organizations that you can go to and find out, are there dentists retiring? Because dentists who are holistic dentists are retiring all the time, or they want to get an associate in or something like this. And so, certainly not like the numbers of regular dentistry. Um, but there are various aspects can look at and figure out if that's a place that you want to live, if that's a practice that makes sense to you, or anything like this. The other aspect is you go to a production facility and you put in some hard work for 2 or 3 years and you save a lot of money, and then you've got enough that maybe you can go find a practice where you want to live and earn and everything like this, and then buy a practice and convert it to a holistic practice if it's not already. So there are a couple of ways of going like that. You just have to see, okay, where do you want to live? And a lot of people want to live on the East Coast or the West Coast, and not as many people want to live in Middle America or in the South or something like this. And so, you know, there might be some opportunities that if geography in the United States is not a problem for you, there could be opportunities that you could probably find.
Okay. So thank you for these answers. Now I'm going to come to questions which are, so a lot of people, if they know, I got acceptance at two schools until now, University of Colorado and NYU. And for the rest of the four schools, I have four other invitation. And most of the supplemental answers and stuff that I wrote down, I learned it from Dr. Cobb, especially the ethical side. And that's what I've been trying to tell other candidates that I'm helping. So I'm going to ask Dr. Cobb some of the ethical questions that are asked in school, and let's see how he answers it from an American dentist who is deeply embedded into ethical dentistry. So, Dr. Cobb, uh, if my work, okay, let's start with this. If my friend was cheating in an exam, or my roommate, and this is a very common question, and he's cheating during the exam, what should I do?
That's a tough one. Definitely go to the student and counsel the student that he's cheating, and cheating cannot be tolerated, and he should go and talk to the administration or the teacher, the instructor in there. And if he chooses or will not or doesn't, then I think that you would have a moral obligation of saying, hey, I saw what happened with X, Y, and Z, and especially a significant cheat. Um, because if the person is going to cheat now on an exam, what are they going to cheat on when they get into private practice? They're going to
From
cheat on the patient? Are they going to cheat in how they do their work? You know, so you don't want to go down that pathway. And so if the student can be counseled and can learn from that and say, I recognize my mistake, I'm going to take my punishment for this, and I'm going to move on, I think the school would recognize that and say, okay, we've had a good learning experience here. You know, this will help you for the rest of your life. But if it gets shoved under the rug and it's not addressed, this will go on and continue and not be best for the student in the long haul.
So I'm gonna play the devil's advocate up here, Doc. If for example, uh, don't you think if somebody's cheating in an exam, he's using his cell phone or she's using her cell phone, shouldn't I go and tell the in charge right after or during the exam, like this person, whoever, whether it was my friend, she or he was using her cell phone or doing some kind of misconduct?
I would probably speak to the student first saying, hey, I saw what you were doing. I saw what you were doing on your cell phone, and this is not appropriate. This is wrong. Let's go to the instructor and talk to the instructor about it. If the student chooses not to do this, then yes, I would be happy to say to the student, if you don't want to go with me to talk to the instructor about this, I'm going to go by myself and talk to the instructor as to what I saw.
Okay.
So, you know, if you can redeem the student, if the student can understand and the student goes and will explain what he did to the instructor and say, okay, I mea culpa, I'm guilty, and so I'm willing to take my punishment. Then I think a lesson has been learned. If they choose not to, then they're covering things up. Then it would be your obligation to go and talk to the instructor about it. And I think that could happen relatively quickly. You know, if the it doesn't take that long to talk to the student and say, hey, I saw what you were doing.
Okay. So what if my roommate who has been doing a party throughout the month and not been studying, and on the last night of the exam, he or she comes and to say, "Hey, can you teach me about the exam for tomorrow?"
I would I would share my thoughts uh, because that would help me reinforce what the exam might be about. So I could say, I don't mind interacting with you about studying for this exam because it's just going to reinforce it better for me. It will probably help the student less because you got to learn early on that you can't take shortcuts. And so if you do it one time, you're going to do it again, and you're going to do it again, you're going to do it again, and then it will catch up with you when you get so far behind that you're going to be lost, and you aren't going to pass. You're going to fail. So you can say, yeah, I'll help you out, but you're really helping yourself out in that particular case by you're reviewing too.
Right.
Y- You know,
Right.
you're reviewing yourself, and so if you're reviewing yourself out loud and asking him questions and things like this for him, I don't see that as a problem. But you know, he will have to understand very quickly that you have to put the time in and you have to study if you're going to pass. If you're going to graduate, you've got to put the time in.
Okay. And what if a patient comes to you and he has some kind of you're in a school setup, not in a private practice, and he has some kind of damages on like physical abuse, something like that. How would you proceed with this kind of patient?
If a patient is physically abused at home or abused at work or outside of the dental arena, and even inside the dental arena, but if the patient is abused at home, by law, and we're looking at mainly people who are young people who are underage, or we're looking at geriatric people. We're looking at old people that might have cognitive decline, and somebody else is taking care of them. And if you pick up physical or mental abuse, or and talking with the patient about that, you have an obligation to share that information with the authorities. It's a crime for us not to um, share what the patient has told us, or if we see evidence of abuse or physical abuse, or the patient says, "Yeah, my boyfriend beat me up," or something like this, that has to be shared with the authorities, and by law, you have to do it.
Okay. Okay. So one other thing is, if my, and this is very common, you've seen people working with you, if one of my colleague or my subordinates or anybody who's not following the laws and not performing, like for example, there are new laws regarding COVID, and she or he is not following, how should I proceed in this situation?
Um, it that's depend. Are they a dental student classmate? Are they an
At
instructor
workplace, at workplace, at a
at both
clinic, at a clinic.
at the clinic?
Yeah.
It's incumbent upon the person of authority, for example, the owner, me, to go to the person or have somebody go up to the person and say, "Hey, you got to wear your mask." That's just what we have to do.
Okay.
Even though we know that masks are dubious at best of reducing infection. The research out there that I've been reading is pretty clear that masks don't cut down on COVID per se. They'll cut down on bacteria and uh, droplets going from one person to another that might have something in them. But as far as straight COVID virus, the virus is so small that it can go through anything that we have, you know, of, of a mask variety. And so, but we still, that's what is expected in the organization. So we have to do it.
Okay.
And for example, we have to wash our hands. For example, we have to use gloves. For example, we have to wear a mask. Those are things that, when I was in dental school, we didn't do any of that. But it's just evolved that that's what is expected. And you'll have the authorities, you'll have the state board, you'll have the Department of Health or whatever down on you if you consistently don't do that. If you don't autoclave your hand pieces, if you don't autoclave your burrs, and it's found out, you'll have a visit from the state board and they'll shut you down. So you have to follow those things, even when some of them might not make much sense.
Okay. Follow the authorities. Listen to the
In
authority.
in those cases, yes,
All right.
because
So
it's on the line.
yes.
And if one patient gets ill or dies from COVID, and they can say, "Yeah, I went into him and he wasn't wearing his mask and he didn't wash his hands and didn't put gloves on," you could be liable. So it's an insurance policy. Wearing a mask is an insurance policy.
And
Wearing gloves is an insurance policy.
yes. And so one question is, how do you think, and this is asked by a University of Indiana asked me this question, how has COVID changed dentistry overall? And since you're practicing right now, you could,
Um, it certainly made us not have as many people in the office at one time. It slowed down what we can do because we take longer in treating a patient, for example, in hygiene. Um, there's I wash my hands about twice as much as I used to. I go and wash my hand probably 100 times a day, maybe 200 times a day. Uh, that's a little bit different. But other than that,
what about
not
prices? Like, do you think the cost of PPEs and mask and shortage and material has caused an effect on the practice? Like, because in the early start, there was shortage of mask and everything.
sure. Yeah.
The prices have spiked up a little because of that,
Oh,
the overhead.
yeah. Yeah. Expenses are more on this. Yeah, it's harder to get PPE supplies. We're groveling for them all the time. We haven't gone without because we have a good supply person, and so the supply person makes sure that we have enough and everything like this. But yeah, that's tightened things up a bit.
And what about the aerosol, like the hygienists use scalers and stuff? Do you think overall in dentistry the usage of aerosol has been limited after COVID?
Yeah, because my hygienists, for example, have done very few ultrasonic cleanings where they used to do it all the time. And I'm putting in an iontophoresis unit for all of my operatories. I've got it in two, but I'm going to put it in the rest. And what an iontophoresis unit does is it puts a charge on a water particle or on a bacteria or on a virus. And so it puts a negative charge on that because these are usually neutral charges to begin with. And then I've got a positive collector up in my ceiling, and it will just suck it over there in a matter of milliseconds. And so I have in my two operatories right now, I have clean air. That's they call it's the same kind of air that they put into making computers and chips and everything like this, to where they can't have any dust in there. So this takes care of the dust and all that kind of stuff. But because my rooms aren't sealed off, it's not it's not that clean because there's air coming in from other areas of the office. But in this area, if there's any splatter in when I'm prepping a tooth or something like this, that's basically instantaneously cleaned up and cleaned out in my operatory. So I'm not too worried about splatter because I think I've got something to take care of that.
So overall, when they asked me in India, and correct me if you feel something is wrong, I told them that since COVID came in, everything became more uncertain. The patient, the doctor, and the staff is on comparatively higher risk. Along with that, the cost of the shortage of material and PPEs have caused the prices to go a little bit up. Along with
Yeah,
that, there has been changes made in laws by CDC, and on daily or weekly or monthly basis, changes are happening in practices. So overall, there is a sense of uncertainty in the system. And the last one I said was that the use of technology is going up. People are using much more apps and internet to get appointments or talk to each other rather than coming
yeah.
front to front. So that was my answer in the interview. But my next question is, and this is asked by a lot of schools and people, like, do you think dentistry is a good profession and a rewarding one? What's your opinion on that?
Oh yeah, I would do dentistry again. Because it fits my lifestyle. It fits. I wanted to be in the medical community. I wanted to be my own boss, and dentistry has allowed me to do that. In medicine, you're usually owned by a corporation somewhere. Dentistry is going in that direction, but it's not completely there yet. There's still room for the private practitioner still, and that's a good thing. So I was able to be my own boss and to be in the medical arena and to change lives for the better and to help keep people healthier than they would without my services, because oral health is huge in keeping a person healthy. If you have infection in your mouth, you have major issues going on systemically. If you've got problems with your bite, with your occlusion, you've got systemic issues going on. So dentistry is primed as one of the best health um, health arenas to be in to help people get healthy and stay healthy.
Makes sense. Makes sense. So, one other, this is a difficult question for you, but I want to say it and see what you answer. If a patient who doesn't want to get treated from you and saying that I want to be handled by an American doctor in a school, for example, and you're an immigrant, like somebody like me, what would you suggest, like how to deal this patient? So the patient is saying, I don't want you treating me, I want somebody who's American should treat me. How should that doctor respond to that situation?
Well, that's hard for me to answer because, as you can see, my skin tone is a little bit lighter than yours. Um,
So
I
my
would probably say, however I can help you out.
okay, my
How
correct me if this is ethically and morally right, but if a patient tells me, oh, I don't want to get treated from you and I would rather get treated from an American person, I could say, okay, if that's something you want to be done, I'm going to call my colleague or whoever that individual in that lab is. If he could fulfill your desire or whatever your demands are for the treatment, that's fine. But from a medical and dental and academic point of view, I'm equally capable of providing you the same treatment as he would. But since it's your choice and it's your consent, I will call that individual and you can talk to him. Would that be ethically right
Sure,
or professionally? Okay.
sure.
All right.
And what I found in dental school is that besides me treating the patient, a dental hygienist would be treating the patient, or an endodontist would be treating the patient, or something like this. And so they're going to get many different cultures in treating this patient. I don't think that will be an issue, though.
It's not. It's,
I just don't think that will be an issue because, oh,
go
yeah,
ahead.
okay. I don't think that will be an issue because I'm not seeing it in my office. And I had an African American working for me, and I didn't see people saying, well, I don't want the African American treating me.
I'm there all
Uh,
the time.
yeah,
I'm standing there all the time.
yeah. So I don't see that as being an issue, especially in this day and age.
Yeah, yeah. There are a lot of Indian, Arabic, Pakistani doctors now, but the schools like to ask this question. So I was going through this. So I'm in my last few questions. My last question is, if somebody today is looking forward to applying to Loma Linda, while filling his application or writing his personal statement or while answering their answers in the interview, what thing should he keep in his mind while talking to Loma Linda? Is there some specific value system or approach he should have in his mind while dealing with them?
I think if he can think about how can he help treat the whole person, how can he help make that person whole, and have that mindset and that outlook, that would be helpful.
Okay,
Versus saying, I'm only looking at the teeth and nothing else.
okay,
Um, it's I want to hear the person. If the person has a problem, I want to hear about it. Maybe I can, give some advice or wisdom, or maybe help them out in some way, or something like this. Um, I think that they would appreciate something like that.
so just to rephrase it, if I was applying to Loma Linda, I will keep my application and my approach more about dealing the whole health of a human being in a 360 well-rounded form, which includes his psychological health, physiological, spiritual even, and then his oral health, right?
Correct.
Okay.
Hmm.
All right. And in the last, I want to ask, people who are migrating as dentists and doctors and practicing in US, some of them are really wonderful with their psychomotor skills and their academic knowledge, mm, but assimilating in the American culture is a process in itself because it's a melting point. Is there some specific advice that you would give to these folks or these doctors or professionals how they could better gel in the system, and as earlier as they do, the better it is, because the system wouldn't gel in according to them. When you read history, that's how America has been a melting pot. So what is there any advice that you would give to people like me and other immigrant doctors and dentists who are coming in?
Yeah. Um, I think this might be the best thing to take away on the whole interview, and that is, um, do everything that you say you are going to do, and do not encroach upon others or their um, or their product, or their life, or their money, or their house, or their goods. So do everything you say you're going to do, and don't encroach upon other people, and don't try to don't try to steal from them,
Okay. All right. Well,
whether it's intellectually or ethically or anything like this.
okay. All right. I'll keep that in note. But thank you for your time, doctor. Hopefully, we'll talk to you soon and we'll get to gather more knowledge and wisdom from you in the future. So thank you
Yeah.
very much for your time, doctor.
Any specific questions that anybody might have, I'd be happy to try to answer them individually if need be.
Sure. That sounds good. Thank you for your generosity and time, doctor. Hopefully,
Good.
we'll see you soon.
Have a good one.
You too. Take care.
Bye.